This is Michelle Sanderson, Oncology massage and lymphatic drainage therapist, and I'm here to empower you to create your own best lymphatic health. The lymphatic system is an essential secondary fluid return system in the body and is comprised of vessels and lymph nodes that assist in returning escaped fluid in the body back to the bloodstream. Commonly, as part of life-saving cancer treatment, people may have damage done to some part of their lymphatic system. Typically, the lymph nodes in 3 specific regions of the body: the neck, the underarms, and the lower abdomen or groin. Damage to lymph nodes resulting from biopsy, surgery, or radiation may cause fluid to back up in a patient's corresponding arm, torso, leg, or head and neck. With a little bit of anatomy knowledge and a few basic techniques, you can successfully and efficiently promote optimal lymphatic flow in your own body. Manual lymphatic drainage techniques can help to promote more optimal flow of fluid from compromised areas to nodes in unaffected areas of the body. Now remember, nothing I demonstrate here today is meant to replace directions given to you from your qualified medical professional. These are general techniques to help you understand and promote the more efficient functioning of your own lymphatic system. So to begin, let's take several deep belly breaths to clear and calm our mind. This also creates lymphatic flow in the deep nodes of our abdomen to receive lymph fluid later on in our session. Let's take 3 deep breaths. So gently placing our hands on our abdomen, we have contact and we feel our abdomen. And let's begin with slow inhalations through our nostril, a brief pause, and then an exhalation through your nose or through your mouth, whatever's more comfortable for you. And let's begin. And one more. To begin our lymphatic work, we're going to start at the end, in the squishy spot, right behind your collarbones. This is where your lymphatic system rejoins your bloodstream. So we want to clear this area to receive all that lovely lymph fluid that's going to be coming in from the rest of the body later in the session. With your hands comfortably crossed over your chest, let's begin with a gentle downward pressure towards your heart. No digging in with your fingertips. There should be just gentle pressure down, no pain. And you're using the flat of your fingers, not your fingertips. And let's do 5 nice pumps here. That's 2. And a gentle pump down towards your heart. 3. And release. And 4. And release. And 5. And release. Now, I'll be back with more props to show you what it looks like to have a compromised and an uncompromised lymph node area, and how we will work that specifically to direct lymphatic flow. Now that our lymph system is prepared to receive fluid, let's look at the most common places of lymphedema swelling in the body. Most oncology patients experience lymph node compromise to their underarms, groin, or abdomen, resulting in swelling of their arms or legs. So let's look at how your body is designed to reroute that lovely lymph fluid to unaffected node areas. Let's look at a very typical scenario of a woman who's had a right breast cancer. Her right underarm or axillary nodes may have been affected by biopsy, surgery, or radiation. Her body gives her different options to be able to reroute that fluid to uncompromised areas, like the exit route that we just looked at, her left underarm or axilla, and even her right abdominal or groin nodes. So what we're going to do first is prepare these other node regions to receive lymphatic fluid. Let's clear the left underarm first. So with the soft flat of our fingers, let's come into that squishy hollow in our underarm, and we're going to be doing a rainbow pumping arc towards our heart, slowly with no pain, and let's do 5 pumps. So come into the squishy spot, and let's begin to pump with 1 and release, 2 and release, 3 and release, 4 and release, 5 and release. And now we're going to do the same thought with the nodes of the lower abdomen. So now we can use a little bit more pressure here because these nodes are buried beneath our intestines, so we're going to be working through quite a bit of tissue here. Let's again use the flats of our fingers, gently pumping in a rainbow arc towards our belly button, but with no pain, just a little bit of pressure. And again, we're going to do 5 pumps. So slowly, let's do a little bit of a rainbow pump in, 1, and release, 2, and release, 3, and release, 4, and release, 5, and release. Now the body is really wise. It's going to use the skin and lymphatic vessels that are located immediately underneath our skin to move this fluid from this compromised area to these uncompromised regions. And these are the directions of flow. One is going to move directly across our chest, and one is going to move down our torso from what would have been our underarm region to this groin. So now that you have a good visual of direction of flow, let's clear that skin space to prepare your body for fluid coming out of the arm. So in positions 1 and 2 and 3, I'm just taking the flat of my hand and I'm gently clearing the skin of our chest in the direction of flow of the uncompromised lymph node region, and I'm tractioning that skin and releasing it, and tractioning it and releasing it. And I'm moving to my next position, and I'm tractioning and releasing, and tractioning and releasing. And I'm going to actually use my other hand now to traction and release, and traction and release. And this is not intended to be a deep massage. We're just pulling the skin to the point of traction and letting it release. Now let's clear this pathway. You can use 1 or 2 hands. It's whatever's most comfortable for you. And so coming under, and I'm a female, of course, so my breast is right here. I'm coming under my breast, and I'm working in a direction of skin traction down towards my groin. So a man could start all the way up here, even on his skin, and coming down and release, and down and release, down and release. And I'm going to move to another position with my hands, down and release, just tractioning the skin, down and release, not trying to do any deep massage here, down and release. And then my final position, just getting as much skin coverage as I can, down and release, down and release, down and release. Now we'll be ready to drain our arm back towards these exit regions. This is where you may want to put your arm on a pillow to help give you some better support and use your opposite hand. So I'm going to be starting on the skin of my arm, closest to my exit root, and work my way down my arm and then back up my arm. And my goal again is to have a soft, flat hand, skin on skin contact, where all I'm doing is tractioning the skin and releasing. Tractioning and releasing. And we can do 3 to 5 pumps in each location. And now moving our hand down, a traction and release. Traction and release. And we can work our way all the way down the arm. Traction and release. Traction and release. Traction and release. We can even work the back of our hand. Traction and release. Traction and release. And then slowly working our way back up towards the shoulder with a traction and a release. Gentle pumping action back towards the exits, up and over the shoulder. And let's crisscross our hands back over the exit roots, and let's give it 3 final lovely rainbow pumps towards the heart. Next, we're going to look at a compromised inguinal region node compromise. So now that we've seen a situation and how we would drain a compromised underarm region, let's mirror that in a situation where we'd have a compromised groin or lower abdominal region. So for instance, we're going to use a compromised right lower abdominal node region. Again, the body gives us lots of routes to be able to send that lymphatic fluid to an uncompromised node area. In particular, the body easily wants to move this lymphatic fluid from our leg across our skin into the left inguinal region, or it can also use reversing up our torso, moving up to our right underarm or axillary region. And this is what those pathways look like. It's a nice short route across our lower abdomen. And then again, our body will use this route up our torso to head towards our underarm. So we've already seen how to pump those lymph node groups in the groin and in the underarm. So let's go through them very briefly again. Let's begin at the left lower. So with soft flats of our fingers between our belly button and where our leg rejoins our body, we're just gently placing our fingers. And we're going to move through this a little bit more quickly since you've seen it the first time through. Let's do 3 pumps. So with a gentle rainbow scooping motion towards our belly button, let's do 3 pumps. 1, and release. 2, and release. 3, and release. Let's prepare our underarm the same way. Gentle flats of our fingers in the hollow of our underarm with a rainbow arcing pump towards our heart. No pain, just gentle flat fingers. 1, and release. 2, and release. 3, and release. Now let's clear the skin pathways of lymphatics, remembering those vessels are immediately beneath the surface of the skin. So we're only using enough traction just to move that skin to its end point, and we can use the flats of our hands. Starting here with 1 or 2 or 3 positionings, we're tractioning and releasing towards the uncompromised nodes and releasing. 3, and releasing. Moving the skin pathway up to the underarm, flats of our hands, gently tractioning the skin up towards the underarm and releasing. 2 and probably using 3 or 4 passes here, and you can even drop one hand out and just use one hand as we're moving that skin up towards the underarm. 3. So now we have our pathways nice and clear. Oftentimes people will find it easier to be seated to be able to drain their leg. So if I have a little stool that I can sit on and then a footstool that I can prop my leg on, I can much easier reach the lower portion of my leg. So much like we did with the arm, we're going to start in the skin region of our leg closest to our body, work our way down, and then back up. So with the soft flats of our hands with full skin contact, we'll begin with tractioning our skin towards our body and releasing. And towards our body and releasing. Towards our body and releasing. And with each movement, I'm moving my hands down a little bit farther. When I get down around my knee, I'm really enveloping my knee with my hands. I can even come in with the scoops of my hands behind my knee, do a nice scoop behind the knee and release. Scoop behind the knee and release. Working my way down the calf, tractioning that skin towards my body and releasing. Tractioning the skin towards and releasing. And one more down towards my ankle and releasing. And then working my way gently back up the leg. Gently back up the leg, scooping behind the knee and releasing, moving towards the torso, closer and closer. Let's finish off by bringing that skin back up over our torso. Let's do a few more clearing pumps in our left inguinal region. Another good couple of rainbow pumps in our underarm, scooping towards our heart. And let's finish off our session right where we started, at that squishy spot right behind your collarbone. Crossing our hands over, gently pumping down towards the heart, and releasing. Let's do 2 more. And releasing, and 1 more. And let's take one nice, deep, clearing belly breath. So that's the end of our brief lymph session. Now, if you have a situation where you have a compromise of both underarms, or a compromise of both inguinal regions, or you've had a head or neck cancer, I highly encourage you to seek out the help of a certified lymphedema therapist who can help tailor a routine to meet your needs. And we thank you so much for joining us here today at Wellness Within. Would you please seek out more resources at wellnesswithin.org, and you can find me at lymphworksmichelle.com.